Next speaker is Dr. Megan Moreno from Seattle Children's Research Institute. She is a member of the Division of Adolescent Medicine at Seattle Children's Hospital and an Associate Professor of Pediatrics at the University of Washington. Her research is housed at the Center for Child Health, Behavior, and Development. And while I was reading through her profile, I just thought this quote from one of her recommendations was really awesome, and it said, "The day we met Dr. Moreno, I feel like she was the missing link. She was so informative and really paid attention to my questions, but more importantly, she was able to connect with my daughter in a way that no one else had. So today is your lucky day because you get to connect with her a little bit. So please welcome Dr. Megan Moreno."
It's really a pleasure to be here tonight, and I have the pleasure of being an adolescent medicine physician as well as a researcher, and so I have the unique privilege where I can sit in clinic with my patients and hear what they're worried about and then take that back to my lab and try to come up with ways that we can study or develop new ideas that I can then take back to clinic and be able to benefit my patients. So with that, I'd like to put us all in that mindset and remembering back to being adolescents. And what I'd like to ask you to do is to please, if you had an experience during adolescence that really contributed to your identity, where you are now, please stand. Awesome. And if you had an adolescence, you can go ahead and sit back down. If you had, during adolescence, if you never took a risk, if you never made a mistake, you never did something you were not supposed to do, you never took a risk at all, please stand. And last, if you really enjoyed adolescence and would like to go back and do it again, please stand. So I hope that by doing this, I've reminded you that adolescence is this tumultuous time. I don't think we need to go far as to say it's a disaster time, but it's a tumultuous time, but it's a really important and formative time where we all take risks and make mistakes, but we also integrate many of those experiences into our identity and what we bring to our work and our life and our loves. And that's the way I look at adolescence. So I have the pleasure of being the principal investigator of the Social Media and Adolescent Health Research Team, SMART or SMOT if you're from Boston. And we are very fortunate to be at Seattle Children's Research Institute within the Center for Child Health, Behavior, and Development. So we're surrounded by pediatricians, psychologists, health economists, other people that are thinking about links between child health and their development. And so our mission as the Social Media and Adolescent Health Research Team is to advance society's understanding of the relationships between media and adolescent health towards educating adolescents, providing better care, and developing innovations in adolescent health. And towards that mission, some of the values that we share are partnering with other researchers, educators, clinicians, community members such as yourself in both the development and the translation of our research projects. And we have a diverse and collaborative research team with team members from a variety of different backgrounds. And we have three core areas of work that I'd like to briefly touch on today. We study social media and health, we study problematic internet use, and we study online safety. And I just want to point out, this is a photo that was taken by one member of my team. Sometimes we do activities where we go out in the community and we look for examples of people using technology. This photo is in no way as artistic or creative as what you see outside. But what I love about this photo, and we have permission from these folks, is that the gentleman is on one phone and using a second phone to look something up. And to me, that's really something that we use those kinds of images and what we see to help it inform what we think adolescents and young adults are doing with technology, and that one's one of my favorites. So the area that we study in social media and health is links between social media and ways to prevent morbidity and mortality with adolescents. And social media gives us a new way to think about that because it's one of the tools and one of the few things that all adolescents can agree on, which is that they use it and they like it. So adolescents, over 95% of them use social media. What's been fascinating over the past couple years is we've seen social media use among adolescents evolve from the old days of when it was, are you a MySpace person or a Facebook person, to this idea of a social media portfolio, where adolescents choose different sites and platforms to interact with and curate content, almost like we might curate our own stock portfolios. And we know that social media is influential to teens in showing them what kinds of behaviors, what kinds of fashion, what kinds of activities are normative for that population. And that allows them to mimic them. Just like we might have in high school tried to follow around a popular kid at school and be like them, now for adolescents, they can just stalk them on Facebook and mimic the behaviors that they're doing in a much more tangible and virtual reality way. So some of the studies that we've done is, I've been really interested in how adolescents represent risk behaviors on social media. So I'm actually really interested in adolescents' ability to tell us and show us and talk about their behaviors and experiences. And we know for adolescents, they're much more risky with what they're willing to put online, both because it's part of adolescent development to take those risks, and there's also a different level of cognitive development where they're more impulsive and able to put things out there. So we've done studies where we've looked at how adolescents represent alcohol use, how they talk about marijuana legalization, how they talk about self-harm and depression, and how they talk about their relationships and whether or not those relationships are safe. So we've been interested in trying to get a sense of what we would call epidemiologic trends in these behaviors and what those behaviors mean to adolescents. At present, we're just wrapping up a longitudinal study of adolescents and young adults where we recruited a cohort of college students from 2 schools, one in Washington, one in Wisconsin, and we recruited them right before they got to college, and we're now in year 5. So we have been following this cohort on Facebook for the past 5 years, and we look at their profiles every month, and if we see significant changes, we call them and talk to them about what's going on in their lives. So we can see a connection between what they choose to post and what's going on for them. So it's been very fascinating. We watched our Washington participants went through legalization around the time that they turned 21. Our Wisconsin participants didn't. So we have this opportunity for a natural comparison between these 2 sites. And in the future, our goal is to be able to use that information that's posted online to try to link adolescents and young adults to resources. So I don't want to give you the impression that we're making diagnoses. What we're looking for is the kids who aren't going to seek care or can't seek care. And if we see these red flags, that we could offer resources or a way to get to clinical care. Our second area of study is in problematic internet use. This is an interesting one for me because I came into these studies initially with the idea that we would disprove that it existed. But like many scientists, my hypothesis appears to maybe not been spot on. So we know from background information that in the most recent Pew Internet and American Life report that 24% of teens reported they are constantly connected. So to me, that's a mic drop moment. A quarter of our teens say they are constantly connected to the internet. And that's something I see in clinic. They sleep with their phones, they walk with their phones, they drive with their phones. They feel that they're constantly connected. And we know that looking at global studies, about 7 to 10% of adolescents have a diagnosis of problematic internet use, meaning internet use that's getting in the way of their functional life, they're not going to school, their social life, and even their physical health. And we see a lot of these kids in our clinic at Seattle Children's, actually. And what's interesting is what often happens is they start to fail at school, and so they get kind of wrapped into this cycle of trying to catch up at school but failing, and then the school eventually asks them to leave and recommends online school. So these kids are really struggling. And so what we've been interested in was one of the early studies that we did was to develop a screening tool called the Problematic and Risky Internet Use Screening Scale, because there hadn't been any clinical diagnostic scales to be able to assess teens. So that was one of our early studies. Right now we've been partnering with a local Seattle school to do the first Seattle-based school-wide PIU screening. And this was a study where we were approached by the school nurse at the school because she was seeing so many kids come be referred into our clinic for falling asleep in class. And most of them were saying that they were either sleeping with their phones or they had tablets in their room and were up all night Facebook chatting or gaming. And so we've been really excited about having a partner within the school system who's also really interested in this idea. And then our goal is to think towards the future of developing and testing preventions as well as interventions for PIU. And I'll show you the picture down there is of a medical assistant who's trying to take the blood pressure of an adolescent patient, but she can't get it to work because the adolescent won't put her phone down. So this is a photo I took because I was sitting across from them waiting for my turn to talk to the patient, and everything was taking so long. And so I just snapped the picture and waited the next 10 minutes to get this sorted out, and then showed the picture to the patient. And we had a great conversation about, what does this picture mean? What does it mean that you couldn't even talk to the medical assistant? What was going on for you? And it turned out that this patient was getting bullied, and she was really worried about what was happening. And so it opened these doors that we could have this really tough conversation. So I think that often when you're seeing this engagement for us with technology, it really opens a lot of doors to have conversations. Another area where we do work is in what I would call online safety. And one of the big projects we have going on right now is related to cyberbullying. And we know that between 7 and 42% of teens report that they've experienced cyberbullying, and about 1/3 of parents report they have questions or concerns about how their child uses the internet. One of the interesting things we've found in the scientific literature is that there's really no definition of cyberbullying. So you could do a research study and say, hey, have you ever experienced cyberbullying? Cyberbullying means mean things. And you might say, well, yeah, that person didn't like my photo, I was cyberbullied. And then there's other studies where they say, have you ever been cyberbullied? That means that these 3 words were used and it was used in these 3 platforms. And you might say, no, I don't even use that platform. So there's a lot of definitions, and that leads to different answers to those questions. So the study we're just wrapping up now is looking at trying to provide an evidence-based definition of cyberbullying so that we can start calling it the same thing. What's really interesting is that what we've seen in clinic is a lot of adolescents don't even want to use the word cyberbullying. And what they'll say is, bullying is what happens to little kids. Maybe I had 30 people that were harassing me 24 hours a day for 2 weeks, but I don't want to say I was bullied because that's what happens to little kids. So it's a really interesting time. We also have been partnering with an empathy researcher out of Indiana looking at whether we could do an empathy-based intervention. The intervention she's built is delivered by text message. So could we partner and then deliver an empathy-based intervention? Really exciting stuff. Another area where we've done some work is around the idea of positive technology use in health. And we know that technology can contribute to education, it can contribute to health, it can enhance social connections. And there's been some studies that show that active use of social media, meaning using social media to actively reach out, to interact, to like other people's things, to communicate, can actually alleviate symptoms of depression. Whereas there's a lot of other studies that show if you're a lurker and you're kind of scrolling around looking at other people's vacation photos and thinking about when was the last time you went on vacation, that can exacerbate depression. So active use can help, passive use can sometimes make you feel worse. So some of what we've been interested in is how do teens use social media in the context of chronic illness. And one study that we did, the picture here is a panel of young women who are cancer survivors. And we worked with them to understand how did each of them use social media during their treatment and recovery. And it was really a fantastic opportunity. I remember one of the discussion points that was really salient to me was one of the youngest members, I think she was 15, talked about how she said she's now a Twitter, she goes on Twitter and she scrolls and looks for hashtags that have to do with newly diagnosed cancer survivors. And then she reaches out to them and says, hey, this happened to me. You can ask me any questions that you want. You can follow me. I'm happy to support you because I went through this too. So I think the idea of a 15-year-old going out there and spending her time doing this was really inspirational to us. We've been interested also in whether we can use social media in the context of existing interventions to promote booster doses. You can imagine, when you go to your doctor for your yearly checkup, you usually get, somewhere between 10 and 20 minutes with your doctor, and in that time, they need to rapid fire deliver all the information you need. You need maybe colon cancer screening, maybe you need breast cancer screening, maybe you need to talk about your high blood pressure, maybe you need to talk about stress at work. Probably not for any of you guys, I'm sure. But they have a lot of things they have to cover. So if you can imagine if your physician had a Twitter account or a blog where you could get some information and have more time for questions, but you could follow your physician on Twitter and get their preventive health tweets. Or you could read their blog for information about, where's the nearest colon cancer screening. So those are some of the things we've been thinking about, is how do we use social media to put out the routine messages or even targeted messages so that the time that's spent in the office is really more focused on you and your questions. So I'll mention we have a couple programs also that we're really fortunate to have that are really supported by Seattle Children's Research Institute. One is our Seattle Children's Research Institute Scholars Program, and this will be the second summer we do it. We invite high school students to come spend a week with us, and during that week they learn about how to do social media research, and they design and complete and present their own projects by the end of the week. And from them we learn a lot about what kinds of projects are they interested in, what kinds of research methods are they interested in, so it's really, really fun. From that, we have a youth advisory board. They review our work and they advise us on potential new directions for our research. They give us feedback on our new ideas. We also have college student internships where we take in college students who are interested either in the research side, the clinical side, or the communication side. And then this summer, I'm really excited, we're having our second SMART conference, which is at the end of June. And it's the theme of it this year is using social media at work. So how do all of us use social media to connect with our populations of interest, with a specific focus on adolescents for us, and how do we use it to engage our communities, and what lessons can we learn from each other? So I'd invite you to stay connected with us, and I really appreciate being able to come and talk with you tonight and hear about the great work you all are doing. Thanks very much.